Thriving in 3 minutes, treating the cheeks.
All right. So tell me about your approach in the cheeks.
So this is my approach for the cheeks. I really like this approach.
Okay.
19 gauge needle or 20 gauge needle. Make a little poke about a finger breadth away and a finger breadth down from the lateral
Orbital
canthus, orbital rim. Yes. And then I use a 22 gauge cannula. 22 gauge cannula is key to me.
How long?
It depends what product I'm using. If I'm using a Define or Refine or one of those products. If I'm using Express technology, I'll use a 50 millimeter 22 gauge. If I'm using a Vicross technology, then I will use a 70 millimeter.
But here you're using a 70 millimeter with a Nasha gel.
Yes, Nasha, I will also use a 70 millimeter.
And where are you? Are you above SMAS or below SMAS?
So I am below SMAS. I'm in theory, into the deep muscle pads. In theory, I'm into the deep fat pads.
Okay, so you're in, like right now, lateral SUV advancing into medial SUV.
Yes, I am. But, I don't go by exactly saying I'm exactly in this fat pad. I go where I think it's best for these patients. I'm definitely deeper than the skin and I'm deeper than the subcutaneous tissue, but I'm also not on the bone. So it's in that area right in there. And I think it's key using that 22 gauge cannula and then laying little strands down as I go forward, back and forth injecting.
And so here are you delivering a bolus of product?
Not necessarily bolus. Going back and forth as
Okay.
I go back. And I put about a cc in there. I'm also lifting the cheek as I'm doing it, and I'm coming underneath anterior, not going into the tear trough all the way unless the patient really needs it, but just anterior into the cheek. And often with Vicross technology, you'll get a nice little filling in of the lower eyelid orbital hollow. Do you notice that too?
Yeah, I find that if you really support laterally, I like to inject more in the prezygomatic space, so underneath SUF. And I feel like when you bring up that orbital retaining ligament and that zygomatic cutaneous ligament, and you support it laterally, that you do improve the appearance of that medial tear trough.
Okay, I think that's a really important point you brought up, those two ligaments, and this is a huge caveat. If someone already has some swelling in that area, between the zygomatic cutaneous ligament and the orbital retaining ligament, they have a little bit of a bubble there.
Yeah,
that festoon. Do not get product into there, or be very careful, because I think that could become worse.
Because I think that we do drain lymphatically. Well, we know we drain medially to laterally, and so if you kind of add more product that draws in more water, it only makes it look worse. So I really like the biostimulators for that area.
I'll use a calcium hydroxyapatite in that area, and I'll go superficial with it, and I can compress it. I got a really nifty technique with that.
And so here, how many strands? So you're going you're almost delivering it horizontally along the orbital rim, and then you're like almost at the nasolabial fold here.
Not so far as nasolabial fold, but I'll go into the medial cheek fat pad. So I'm pretty deep there, and it really depends on the individual patient.
Great. So here she's had a total of 0.8 cc's, and you covered that entire cheek under SMAS, kind of in the deep subcutaneous fat pads.
And I tell them it's going to last about a year, is what I usually tell people.
If you're delivering 1 cc
I'm delivering 1 cc.
of this Nasha gel.
Nasha, I'll get a little bit more lift, and I'll get a little bit more fullness in that area. I'll use Vicross if I want to get a little more diffusion of that lift, diffusion of the volume.
Okay, beautiful. So now you can thrive in treating cheeks in 3 minutes.
Yes.
I love your technique.
Thank you. Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.